A weak or injured lower back is something that we all want to avoid. In today's video, we're going to cover one movement, the hip hinge, which is going to help you not only protect an injured lower back, but also build real back strength for the long term. If you're new here, welcome. I'm Michael Fatika, the lead osteopath and spine specialist here at Back in Shape, and we help people in the UK and around the world fix their back pain and get back in shape for the long term. This video has three parts. Firstly, for the beginners, we're teaching you how to specifically do the hip hinge movement with some expert tips to make sure you don't get it wrong and mess things up. Secondly, we're going to explain why this movement is so vital in everything that we do on a daily basis, especially if we have back pain. And finally, we're going to take this simple exercise and make it more advanced using weights and other strategies, and we'll cover those with you so that you can have a great exercise perfect for building back strength and massively reducing the risk of back injury in the future. To perform the hip hinge, it's really quite simple, but the details really matter. First of all, we're going to stand around about shoulder width apart like so. We're going to make sure that we're setting ourselves so we've got our core engaged nicely, we've got our back muscles engaged nicely, we've got our posture well. From this point up, the spine doesn't bend. Then clasp your hands in front of you as if you're carrying a weight of some description, and then we're going to just gently allow our bum to go backwards as low as we can until we feel our hamstrings, that's the muscles on the back of the thighs, limit our movement. At that point, we then come back up to the top and we repeat the process, driving from the hips or the bum, going backwards, keeping the spine nice and neutral, and then up, keeping the chest and core engaged throughout the entirety of the movement, as low as you can go. Many of you doing this will be able to go further. If you've got a little bit of back pain, you might not be able to go this far at all, but you must keep your spine nice and neutral as you're going through this movement and have the hands as they were down here, ready for later on when we're going to be using some weights. Again, a couple more reps here at the bottom of the repetition, feeling it in the hamstrings, that's as low as we can go, and avoiding anything like this, because there we've lost the movement and we're not doing it correctly. When you're doing the hip hinge correctly, as we go down through the movement like so, there are a couple of places that we should be feeling it. Now, of course, we should have our core engaged, we should have our middle back muscles engaged, that's these over here. We should have our posture nice and strong, and as we're going down, the thing that's stopping us is our hamstring flexibility. As our torso hinges and our spine hinges, it is the hamstrings extending at the hip, getting longer, that is the thing that stops us from going any further. So when you get to this point here, where you stop, like a drawbridge, it is these hamstrings that you might feel a tight tension, etc., being stretched, for example, that is stopping you going any further. And then the second place that you will feel this, which can be a bit unnerving if you've got lower back pain, is in the lower back. Remember, the lower back muscles need to be engaged for this. And as you lower down like so, those back muscles are the only things that are working against your hamstrings to stop your spine buckling. So it is very normal, as we get towards the bottom part of the hip hinge, to feel the tension in our lower back muscles elevate slightly as our hamstrings allow us to go no further, stopping movement from leaking into our lower back. If you want a little bit more information about that dedicated movement leak that you need to avoid, then check out the link in the description. It's completely normal to struggle with this when you're first starting. Many people that are working out in the gym are not doing it right, let alone if you've got a lower back injury. So we've got a couple of beginner's tips to help you get it right. And number one is going to be using a band, helping us get the actual movement going in the right direction. So what we're doing here is we're placing the band, which I'll show you in a moment, around the front of the hips. And to do that, we find these bony bits on the front of our hips here, and we just come down about an inch. That means the band is going to be placed directly on the front of our hip socket. So as we are using the band, which you'll see in a moment, to pull, it is pressing right where we need to initiate the movement, not up here, which will result in rounding the lower back. So what you do is you get a little band, loop it around a doorpost or banister or something like that, and hook it in position. Just find those bony bits, come just lower down, and you step away from the anchor point so you can feel it's pulling you back. Do all the same set points, so feet shoulder width apart, slight bend in the knees, nice and tall, posture engaged, back muscles engaged, hands down, and just allow the band to pull your hips backwards, and then come back up. And allow the band to pull through your hip sockets and pull your bum backwards. This helps you get this movement right, so you can just focus on holding your leg muscles strong, holding your spine strong, and allowing the band to pull through the right position so you initiate movement correctly. Tip number 2 talks about the tape test. You can do a full step-by-step tutorial on this, link in the description, but just to cover it now, it involves you getting some sellotape and lining it up along your spine here, finding the 2 bony bits at the base of the spine, which are these 2 bits here, and then sticking the tape from there up about 3, 4, 5, 6 inches or so, and then doing your hip hinge with the tape on your back. And you'll actually feel, if you're doing it wrong and allowing your spine to move, you'll feel the tape pulling your skin sooner, and you can start to dial that movement in. Again, link in the description to follow along with that step-by-step video after this one. The final beginner's tip is the squat hinge. And this is basically an error. It's to combat an error. Basically where people, when they're learning to do the hip hinge, they kind of do a bit of a squat hinge and it doesn't really work. The knees go forwards. And for this, you're going to go and find your dining table chair. You're going to walk up nice and close to it so your shins are touching the chair. And then you're going to do that same hip hinge movement. Thinking about the practice that we just did with the bands, thinking about perhaps that tape test as well to help you prevent your knees from going forwards because they'll hit the chair. This can really help you force the correct cues of your hips going backwards to initiate this movement and learn to do it correctly. So why is the hip hinge so important? One of the big things that stops people with back pain getting better and is a source of injury or aggravation when we have these sorts of injuries is the daily tasks. And that could be moving the laundry, it could be washing your face, it could be brushing your teeth, it could be picking up the grandchildren, it could be getting the groceries out of the car. You get the idea. All of these movements involve hip hinging. And they should involve hip hinging. But all too often, we're just getting into the position where we're rounding over like a fishing rod. And that is absolutely no good. And if we can start to learn to do this movement correctly, especially if we've got back pain, we're going to massively speed up the rate of recovery whilst minimizing any relapses along the way. And if we're someone in the gym who's working out for building strength, then we're going to make our strength training so much more effective, so much more helpful, and it's going to massively reduce the risk of back injuries because every time we're in the gym, we're practicing a movement correctly. So simply put, this is one of the foundational exercises that you must do and you must get right. And that's why it features very heavily for all of our members and patients in the Back in Shape program. In the next part of the video, we're going to talk about how you can scale this exercise to build strength properly. Because once you've mastered the foundationals with no weight, we need to start applying resistances and making it more difficult so we can benefit from this exercise and actually have it build strength in both our discs, our spine, and the muscles of the legs and lower body as well. You're going to want to try and do these steps in order because there's rationale and I'll explain why. The first step we're going to use to incorporate resistance in the hip hinge is going to be a resistance band. And the primary reason for this, for someone learning this movement, the vulnerable point is when you're lower down here. This is where accidents happen. That's where you're under a position of, or in a position of mechanical disadvantage. You're going to be relatively weaker at this point. And the great thing about the bands is if we pop them into position 1, 2, and hold it up here, is that the band is very strong up here where I'm very strong. Even if I've got a bad back, I'm going to be okay in this position, or relatively, it's going to be a lot easier. As I go lower, I get more and more vulnerable. I get more and more weak as well as I get down to this bottom position. And as I'm doing that, the band becomes a little bit easier because it's got a little bit less tension on it. So I can go through my hip hinge movement using the band to begin with in a way that challenges me, but also gives me a little bit of laxity, if you will, in the more challenging parts of the repetition. And this is why bands are a great starting point when we're doing the hip hinge exercise or squats or other sort of split squats for that matter. So start out using bands like I mentioned. The next logical step is going to be using either a dumbbell or a kettlebell like those down there. And here we have 2 sub-steps, if you will. The first is to hold the weight nice and high up here. And again, we do exactly the same with the hip hinge. We stand, feet shoulder width apart, nice and engaged with all the muscles, and we move into the hip hinging position. The second step is to hold the weight lower down like so. And here we go through exactly the same training points, going into this hip hinge, making sure we are only bending at the hip socket and our spine remains neutral. Why do we choose these 2 variations? Well, firstly, it provides a natural limiter. For those of you recovering from back pain, maybe you've had a herniated disc or something like that, holding the weight up here means your arms are likely to give out first, so it'll force you to progress a little bit more slowly. You can then progress on with a little bit more weight, holding the weight down here, so you can continue to go on further. It's particularly helpful using this sort of progression if you're learning to do the exercise, because your hand strength, which will improve, will slow down the rate at which you start piling on the pounds. We've all seen people in the gym, they get a bit too excited, They start doing the weight just to hit numbers, and they're doing it with really bad form. So this just helps temper that process of progressing with the weights too quickly. The final step, obviously, is going to be using a barbell. And again, same thing. Feet shoulder apart, nice tall posture, core engaged, and then we're slowly coming down and back up, down and back up. This is a great option for you to obviously continue to increase the weights you're using, stacking weights onto the bar and building your strength for the long term. There's one reason that I hold the bar like this to start with, and it's similar to what I mentioned for the dumbbells. Holding the bar with a double underhand makes it easier for you to stand in what's called the anatomical position, a nice position which encourages good posture, engagement of our middle back muscles, and an upright position. When we go for over or split stance, personally, when you're starting out these things, I like to have symmetry when we're going through these things. And so the split stance just makes you feel a little bit different sometimes. Which side are you going to go with all the time? And double over is a bit more hunching. We have enough of that on the computer every day or working on the desk from home. So having that double under really opens you out, and you'll just find it feels a little bit better. And again, helps you work that grip strength. Your grips will give out sooner when you're doing double under than when you're doing the other variations. And therefore, it's another strategy for you to be able to more slowly or gradually increase the weight. So for those of you that are a bit of risk of the ego getting ahead of you, that doesn't take hold and you start lifting weights that are a little bit too heavy for what your spine is ready for. Those grip tips are really quite important for those of you that are recovering from a back injury, or if you're working out doing this sort of movement to build your back strength for the long term because you've had some sort of injury in the past. These tactics will really help you have success without getting that classic issue that really plagues a lot of people in the gym, where they love working out, they get back to it, they keep re-injuring themselves, and they think, am I ever going to be able to do this exercise again? If you do it right and build slowly over the long term with sensible little tricks, you can really get into this great movement, build your back health for the long term, and massively reduce the risk of any injury in the future because you're not pushing yourself too quickly, let alone using anything like straps, which we haven't discussed today. One final variation to help you is the beast stance. And this is a slight split stance hip hinge, and it's really cool for those of you that maybe notice as a result of maybe some sciatica you've had in the past or a herniated disc, that one hamstring is a little bit tighter or a little bit less responsive than the other. And this allows us to really focus on one side and then the other to really measure for that difference in a way that standard hip hinges aren't going to do. And what we're doing here is we're just standing with a slight split stance as if we were doing a hamstring stretch, for example, and then we're just simply lowering down and driving back up through that foot, lowering down and driving back up through this particular hamstring. And you'll feel a really nice stretch at the bottom, and then you're using that to drive back up into the movement. You'll really feel that hamstring get activated. You're not going to be able to use as much heavy weight, but this can work really well if you're trying to use your strength training as a combination of both building strength and also getting a really nice stretch in to improve the mobility of your hips and hamstrings specifically. We discussed this in a dedicated video where we went through 5 steps to improve your hamstring flexibility immediately. And this was one of the final steps, which can really, really work well to improving hamstring flexibility, which is going to be one of the major limiting factors in how low you go when you're doing the hip hinge. So there you have it. A great exercise to both recover from lower back pain, but also build long-term back resilience. If you need any more help with your back pain, then you can always check out the free Fixing Back Pain Masterclass, link in the description. If you need a bit more one-to-one guidance, we've got the full membership to the Back in Shape program. And of course, all the links and resources that we mentioned in this video are down in the description. We hope you found this helpful. Start practicing it right away, the hip hinge that is, and we look forward to seeing you in the next video.